The next big trend is one that I think ties all the trends together, and that is the area of cognitive health. Because if we're not right mentally and if we don't have good mental health, then we won't be able to achieve the activity levels that we aspire to or be able to do our daily routines as we would hope to. And I think we all felt that particularly throughout the pandemic. It was a real sign, I think, to everybody to pause and think about actually what our mental health means to us. And it really is a sign that if you manage to look after your mental health, you'll be able to cope with other stressors and you'll also make good decisions. When we think of cognitive health, there are a number of different aspects. So it can be, can I cope with my daily routine? Do I feel anxious? Do I feel stressed? Other areas are, do I remember as well? How is my memory? How is my mood? Do I feel present? These are all aspects of our daily lives that, form part of our cognitive health and how well prepared we feel to deal with our day. Now, with cognitive health, we know that there are extremely strong links with nutrition, and they start from when we're a fetus, when we're in the womb. There, for a long time, have been recommendations about DHA, docosahexaenoic acid, the long chain omega-3, to ensure that children have, good levels of DHA because of its selective accumulation in the brain. And it's important as a long chain fatty acid. But we now know that throughout life, omega-3s are important at all stages in life, both EPA and DHA, and increasingly studies are highlighting the importance of omega-3s, not just to maintain cognitive health, but also to potentially reduce the effect of cognitive decline. Oxidative stress has significant implications for overall cognitive health, and as a result, a variety of antioxidants and polyphenols in the diet can support prevention of cognitive decline. With antioxidants and polyphenols, the key recommendation here would be to have a complete mix, because no antioxidant on their own can effectively support the brain. So a mix of antioxidants and polyphenols would be the recommendation. Being adequately hydrated is consistently linked to cognitive health and cognitive function. Even a small percentage of dehydration can affect our ability to do daily tasks. And therefore, ensuring that we are hydrated or maybe looking at nutritionals that support both hydration and water retention may be extremely important. And then there's another category, the adaptogens, things like ashwagandha, for instance, which are an emerging category. And while the evidence is still being developed to support these, there is anecdotal evidence and also historical evidence in certain communities that suggests that these adaptogens may be important, particularly to help with things like stress, for instance.